Mr. President.
The Senator from Idaho.
Mr. President, I ask unanimous consent to speak as if in morning business.
We are currently under a quorum call.
Mr. President, I ask unanimous consent that the quorum call be lifted.
Without objection.
And I ask permission to speak in morning business.
Without objection.
Thank you very much, Mr. President. I rise today to discuss Medicare also in the context of the proposed health care reform that we are dealing with here in the Senate. This is one of the most troubling aspects of the health care reform proposals that are being considered in the Congress. The massive cuts to Medicare that will total, under the legislation that came out of the Finance Committee at least, about $500 billion in cuts. And similar levels of cuts are included in all of the major legislation being moved at this point. In this time of economic downturn, all Americans must look to their budgets and to their own spending very carefully. The same is true for the federal government. And some will argue that these Medicare cuts are necessary for fiscal responsibility and that everybody must play a part. Others are going to argue that Medicare is facing insolvency in 2017 and that these cuts are necessary to slow the growth of Medicare spending. In fact, the 2009 trustees' report showed that Medicare's annual costs were 3.2% of the gross domestic product of the United States in 2008. To give a little bit of context there, that's about 3/4 of Social Security's cost. These costs are projected to surpass Social Security expenditures in 2028 and reach 11.4% of GDP by 2083. The unfunded obligation of the Medicare Hospital Trust Fund is $13.4 trillion, which is $1 trillion higher than even last year's estimate. And Medicare's total unfunded obligations, which include Part B and Part D programs, have reached $37.8 trillion. Yes, we do need to address the solvency issues related to Medicare. We must deal with it. But let's be clear about one thing. These proposals in these health care bills do not strengthen the solvency of the Medicare program. We put up the chart, please. These cuts accomplish one simple goal. That is, they take money from the Medicare program in order to use it to create a new entitlement program. The program is created at the expense of America's seniors. We're not shoring up Medicare for America's seniors with these bills. We're transferring $500 billion out of the Medicare programs into a new government entitlement program. A recent article described it like this. Let's imagine that Medicare is your family's health care budget, is your family's overall budget. And you've lived beyond your means and you've run up a huge debt. And in order to deal with this new debt, your family thinks of creative ways to cut spending and reduce expenses and put some of your savings aside in order to catch up. Then, though, you see with all this cash that you've saved up that you would like to go out and buy a brand new car. And so instead of using the cash to help pay off your debts and your obligations and shore up your financial circumstances, you take this cash and you go out and spend it on a brand new car, in this case, a government-run car. This is what's happening with the Medicare system in the bills before us. These cuts damage an existing entitlement program in order to create a new one, harming America's seniors along the way. They're going to negatively impact choice, access, benefits, and quality of care. When Americans said that they wanted change, I don't think this is what they were talking about. Now let's talk about a few specifics. Among the largest cuts to the Medicare program are the $117 billion in cuts to the Medicare Advantage program. Currently, there are nearly 11 million seniors enrolled in Medicare Advantage, which represents about 1 out of every 4 Medicare beneficiaries. In my home state of Idaho, there are more than 60,000 Medicare Advantage beneficiaries, or 27% of the Medicare beneficiaries in the state. Since the creation of the Medicare Advantage program in 2003, overall enrollment in private plans has been steadily increasing, and beneficiaries across the country have had more private plans to choose from than they did 10 years ago. A 2007 study reported high overall satisfaction with the Medicare Advantage program. 84% of respondents said that they were happy with their coverage, and 75% would recommend Medicare Advantage to their friends or family members. According to the Congressional Research Service, as of January 2009, all Medicare beneficiaries across the country had access to Medicare Advantage plans, along with traditional Medicare plans. The choice is particularly crucial in rural areas. Between 2003 and 2007, more than 600,000 beneficiaries in rural areas joined the Medicare Advantage program, which is a 426% increase. The Medicare Advantage cuts proposed in the finance bill will force plans to cut benefits, increase premiums, or drop coverage altogether. In fact, CBO estimates that enrollment in Medicare Advantage will decrease by 2.7 million people by 2019, resulting from the changes in this proposed legislation. This number represents not only people who would lose their plan, but also those who would no longer be able to choose Medicare Advantage because of the decrease in benefits. CBO estimates that the value of extra benefits offered by Medicare Advantage plans will drop from $135 a month to $42 a month. And when we were in the Finance Committee markup, I asked CBO Director Elmendorf to confirm this point. I asked him, so approximately half of the additional benefit would be lost to those current Medicare Advantage policy holders. His response was, for those who would be enrolled otherwise under current law, yes. The point here is that the Medicare Advantage cuts in the Finance Committee bill will clearly break the President's pledge that if you like the insurance you have, if you like the protection you have, you can keep it. Even if some seniors on Medicare Advantage are able to keep their plans, they're not going to be able to enjoy the same level of benefits that they enjoy today. During the Finance Committee markup, I offered an amendment that would have prohibited the implementation of the bill's Medicare Advantage provisions if their implementation would decrease choice and competition for seniors in Medicare. Very simple and straightforward. The amendment was defeated on a straight party line vote. Many congressional Democrats argue that by defending Medicare Advantage, you're actually defending overpayments to insurance companies. That's not true either. Medicare Advantage plans are paid 14% more on average than traditional Medicare fee-for-service. However, these overpayments, or alleged overpayments, don't go into the plans. They go to the seniors enrolled in the plans in the form of extra benefits. That's why Medicare Advantage is so popular among seniors. 75% of the additional payments to Medicare Advantage are used to provide seniors with additional benefits. Benefits like dental coverage, or vision coverage, or preventive medicine, or flu shots, or hearing aids. And the remaining 25% is returned to the federal government. So the cuts to Medicare Advantage will reduce benefits and will deprive seniors of choice. But that's not the only kind of cuts that we have coming to Medicare. In addition to the cuts to the Medicare Advantage program, the Finance Committee bill also contains massive cuts to other Medicare providers. It contains $40 billion of cuts to home health agencies. There are nearly $8 billion of cuts to hospice, and more than $16 billion of cuts to skilled nursing facilities. These levels of cuts will be devastating for providers and will threaten access as well, as more and more providers will not take Medicare patients. It will be harder and harder for beneficiaries to find care. I spoke recently to Gary Teton, the president and owner of the Idaho Home Health and Hospice, just last week, about the impact of the Medicare cuts on home health and hospice. He described to me just how bad the fiscal situation has become for home health, hospice, and other Medicare providers in Idaho. Idaho lost nearly 30% of its home care providers in 1998 and 1999, including the state's largest provider. The providers that are still in business in my home state are working under the same Medicare reimbursement levels that they received in 2001, 8 years ago. If the cuts from the finance bill went into effect, on top of the current reimbursement issues the situation would get significantly worse for many providers. And the net result, again, would be a loss of providers, a loss of options, and a loss of services to our seniors. Costs have gone up considerably due to the economic downturn, and rural Idaho is being hit the hardest. Gary compared the situation for home health and hospice providers to farmers in Idaho. Most farmers don't grow just one crop. Similarly, home health agencies don't provide just one service. They provide hospice and private duty care along with medical supplies and equipment. All of these services are going to suffer because of the home health and hospice cuts. These proposed cuts will not just affect providers in my home state. They will affect Medicare providers in every state around the country, particularly rural states which already face significant provider access problems. At some point, providers will no longer be able to give the best care, or any care, for that matter, to Medicare beneficiaries. And as I indicated earlier, we've already seen the trend start of those medical service providers who simply can't afford to take Medicare patients. I've long supported policies that increase access to high-quality, affordable health care for all Americans and provide for fair reimbursements to providers of the medical services rendered. However, the types of blunt, across-the-board cuts that we see in these proposed bills will result only in increased harm to providers and to Medicare beneficiaries around the country. Mr. President, it's my hope that as we face these difficult times in dealing with needed health care reform, that we will not take the cuts out of the Medicare program that are proposed in this legislation. Specifically and importantly, it's critical that we not cut our Medicare beneficiaries' services in order to simply fund a new, massive government entitlement program. With that, Mr. President, I yield the floor.